You're right, bro. Did you say volume? Come on, volume.
I can hear you, Doctor.
You can hear me?
Yes, all is good, but now you must keep quiet. People are already watching us.
Oh. Okay.
As long as we're connected, then I'm happy. So,
okay.
So I'll mute you and open you just 2 minutes before.
Okay, no problem.
Yeah. I think your light on the face could be enough. Get more light. Don't you have like one of these lights that I use during load shedding, just to give more light, from the front?
Okay, sure. Let me try and get that. Okay. So which way should I place it?
Ask the young man to place it. I'll tell you when. Where's your young man? Just place it nicely so that we can see your face without any shadow.
Because place it in such a way that.
Yeah, that's good. That was good. Yeah. I think that's good. Yeah.
That's perfect. Okay. Huh?
Like that. Yeah, that one is good. He did something. It's a bit dark now. There's something that he did, but you okay. I think you're good. You're good.
Is that fine? Okay, cool.
But I'll mute you, Doc, until just 2 minutes before.
That's
so
fine.
10 minutes of
Okay,
meditation.
sure.
All right. Sure.
Okay. Ngiphathela amanzi.
We've got a minute to go. Good evening, ladies and gentlemen. Thank you for joining us via various social media platforms, Facebook, Twitter, YouTube, and also the Dr. Fundi platform. Welcome to the Dr. Fundi channel. My name is Dr. Fundi Lenyati, and our focus today is on the COVID-19 pandemic in the Western Cape. And my special guest tonight is Dr. Nomalizo Tefu. She is an economic migrant all the way from the Eastern Cape. She came to study physiotherapy many years ago at UCT. She decided, no, she needs to add more qualifications. So she went and studied medicine and qualified as a medical doctor. So she was a physiotherapist, then she became a medical doctor. And before then, she had spent some time at Forte, where she qualified, with BSc in chemistry. So she's a chemist, she's a physiotherapist, she is actually a medical doctor. And ever since she qualified in 2006, she has worked all her working life, in Cape Town, initially as an intern, a medical intern, and then later as a community service doctor, and later as a medical officer working in Khayelitsha. After that, she decided, no, she wants to go to the private sector, had a stint as a GP, and later decided, no, she would like to work in the corporate environment. So she started as a clinical, advisor within the Metropolitan Health Group, and she's gone up the ranks to senior management level. And so, we couldn't have asked for a better person to actually, help us understand what's happening in the Western Cape. So, Dr. Tefu, welcome to the Dr. Fundi channel.
Thank you, Doc, for providing me an opportunity to be on this platform. Greetings to the viewers as well.
Yes. Now, Doc, I introduced you deliberately as an economic migrant. Somebody who actually labeled people like you as economic migrants. Umamuzile.
I know.
Work in the Western Cape, and then you end up not wanting to go back home. People there in Tanzania and East London, they still want your skills. When are you going back?
That's the dynamic that I have. I still want to go back home, but I feel Cape Town is more home than East London. And I've been here for a while. Yeah. So okay. I can't promise anything. I'm just hoping that they do have good doctors in Eastern Cape.
Yeah. Okay. All right, Doc. Let's focus on the business of today. Yesterday I was looking at the news update on the pandemic, looking at the country, South Africa, but also specifically the Western Cape. And there was just something that worried me about the stats that were coming out of the Western Cape. The first thing that worried me is that the Western Cape is the only province that has got more than 2,000 confirmed cases of COVID-19. All right, followed by Gauteng. And the difference between Western Cape and Gauteng is almost 1,000, cases. That was the first thing that worried me. And in fact, Western Cape, makes up about 42% of the total caseload up until yesterday. And also in terms of the number of people who have died as a result of COVID-19, the Western Cape has got the most number of deaths. So with that kind of picture, one thought it would be important to speak to somebody who's on the ground, not ask to speak to a government official, no, somebody who's independent, somebody who's on the ground, to just give us an understanding of what is it that is happening in the Western Cape. Obviously, the Western Cape is bigger than Cape Town, but the bulk of the cases are coming from the greater, Cape Town, area. So, as somebody who is there, Doc, just maybe the first thing, South Africa, this is week 6 of the lockdown. We had our first case on the 5th of March. And so this is like 6 weeks later. We are now somewhere around 6,700 cases. What is your sense of how South Africa is doing as far as managing this COVID-19 pandemic? The country as a whole, before we talk about Western Cape.
Okay, I think just to highlight that for me, looking at the stats globally and locally in South Africa, there are 2 key indicators that will concern me. So the first one being the demographic profile, meaning the age, the gender, the pre-existing conditions, and the socio-economic status. And then the second factor would be the season or the climate change. So basically, my concern is that we have seen an increase in the number of deaths and in the number of cases in first world countries like Italy. And, and also we have seen what has been happening in the winter season in that side. So the concern that I have is that we might be faced with a crisis comes winter season in South Africa. And considering also the fact that we are in the third world country, and also considering our health sector, that it's not doing well compared to the first world countries like Italy. Yeah. So I think, Doc, what I need to concentrate on is the focus in Western Cape, because it's currently now the
before you go to the Western Cape, Doc,
okay.
No, don't rush. I've got all the time to ask you about the Western Cape. South Africa, how are we doing in handling this pandemic? Looking at the country as a whole, we are at just about 6,700 cases. There were predictions that the numbers would have been much higher by now. So yeah, what's your sense?
Okay, I think to be honest, I'm a bit concerned because we've been in the lockdown. It's week 6 now, but we still saw an exponential growth in terms of the curve, and yet we were on lockdown. And also, as I highlighted, that we're still not in the winter season yet. So my fear is that what's going to be happening when we hit the winter season. And also considering the fact that looking at our socio-economic status, most of the people have a very poor socio-economic status. Yes. So we might be faced, with a crisis.
Yeah, all right.
Yeah.
Okay.
So right. I think just to answer your question, I don't think at this stage, it's too early at this stage to say this is how we're doing. Yeah. Because we're not in the winter season yet. Even though they have been drastic measures that have been put in place to try and perturb the virus, the spread of the virus. Yeah.
Okay. All right. Let's get back to the Western Cape then. The Western Cape, for some time, it was number 2 after Gauteng. So Gauteng was the epicenter for a long time, up until just over a week ago, when it was overtaken by the Western Cape.
Yeah.
So at this moment, we are actually saying the Western Cape is the epicenter of the pandemic in South Africa. Now, does that concern you as people who are in the Western Cape, the fact that you have already got to a point where your cases are 42% of the national load, and you've had the most number of deaths than any other province in South Africa.
Yeah, definitely, Doc. There is a concern there. But I think it's critical for me that I raise the key issues that I've identified that are contributing to the rapid rise in the number of cases that we're seeing. So the first thing that I've observed, because I'm going to speak largely about Khayelitsha because that's where I'm based.
No, Doc. We're going to go to Khayelitsha. You see, I started from the country, and then now I'm zooming into the province, to say, and then I'm going to zoom in to the, the Cape Flats, especially the Black Townships. So yeah, don't be in a hurry, Doc. I'm still just talking now about the province of the Western Cape. Something seems not to be working well. The numbers are growing exponentially out of just about 440 overnight last night. Well, the numbers that were released last night, about 340 or so were actually from the, from the Western Cape. So it seems like the caseload is rapidly growing, and it's out of pace when you compare it with the rest of the country. And maybe that's my issue. You are in Cape Town. You are closer to the seat of government of the Western Cape. What sense are you picking up from those who are leading healthcare in that province? Do you think they are concerned by the numbers? If yes, what visible measures have you seen that they have taken to try and correct and turn around the situation?
Okay, so to be honest, I don't have a view of the risk mitigation strategies that have been taken by the actual Department of Health to try and mitigate. Yeah, because what's happening is that the general practitioners and the Department of Health are working in silos. So we don't really have a view of the current risk mitigation strategies that are being put in place to try and mitigate, what we are seeing between the different provinces. So I will be able to say this is what has been currently put in place to try and mitigate what's happening here.
But as an observer, you are a healthcare professional that's practicing in the Western Cape. Fine, you don't have access to their strategic plans and stuff. However, just observing, when it comes to issues, for example, of public health education, do you think there is enough public health education around, the dangers of this pandemic? Do you think people generally are abiding, to the regulations of the state of, disaster? So just as an observer then, because, last week on the first day of level 4, we saw lots and lots of people, there at the promenade, and there were no masks, and there were just crowds. There was no social distancing. So for us who are watching from far, we got a sense that the people in the Western Cape, specifically Cape Town, don't seem to be that perturbed by the dangers of this pandemic. So that's why I'm asking this question before I zoom in, to the issue of the Black Townships of Cape Town.
Okay. So I think there are key things that I said I wanted to highlight. That the first thing that I've observed is that there is definitely lack of awareness about the existence of the virus, especially in the Black communities, because there has been a perception that it's a white man's disease. And then the other thing that I've observed, particularly in Western Cape, is that there has been a work environments that have had a huge number of employees that tested positive. Like for instance, there is one supermarket that had about 55 employees that tested positive. And also there is
one supermarket.
One supermarket, yes. They had 55 employees that tested positive. And also there is one pharmaceutical company that had 100 employees that tested positive at the same time.
Yes.
Yeah.
Also, so basically what you are saying, from an awareness, public health, awareness point of view, you think there's a lot that needs to be done to get people to understand about this invisible enemy, which is the COVID-19
yes, definitely.
disease.
That's what I'm saying. And also, I think.
Yeah.
Sorry, Doc. I was saying that I also think that there is a lack of understanding on how the virus is acquired. And therefore, that's why people are not taking preventative measures, like wearing the masks in public, because some people don't even understand that, the virus can be acquired because it stays for more than 8 hours in the air. So there is those elements.
All right. So basically, Doc, I mean, if I just try and remember the population down there in Cape Town, people are largely, they likely speak English, Afrikaans, and Xhosa, right?
Yes.
There may be a few other people who speak other languages, but those three are the three dominant languages that are spoken there. Now, in your observation, has there been a lot of awareness in vernacular, specifically, Xhosa? Because we've observed that in other provinces, even here in Gauteng, we've had to actually record Q&A or awareness sessions in vernacular as a way of trying to unpack this thing in a language that people can understand. So as people who are there in the Western Cape and Cape Town, have you had any messaging that is actually in vernacular?
Yeah, so there's been posters that have been circulating around. For instance, we've seen posters that have been circulating written in Xhosa, and there's been posters that are circulating written in Afrikaans. But in all essence, are people reading those posters? Like, for instance, in the practice, we do have posters that we've put against the wall. But is that enough, for people to read? Because some of those things are written in fine print. So yes, even though there are posters that are circulating in vernacular, but I don't think that is enough, to make to raise awareness amongst people.
So I'm going back then to, I want you to be the judge. Do you think the Western Cape government is doing enough from a preventative point of view? Now, preventative being health promotion, awareness creation, and also, early detection through testing. Do you think there is much work being done to create more awareness and also get to test people long before they actually present to healthcare facilities?
No, I definitely don't think so. I mean, I'm saying this based on the experiences that I've had. I don't think that the Western Cape Department is doing enough, to do mass testing, to deploy enough health workers to access those areas that are high-risk areas, so that they could identify, people that may be infected. So, and also, I don't think there's enough awareness that's raised amongst people to actually understand about the virus itself.
Yeah. Okay. So, because, last week I listened to, is it Winde, the Premier of the Western Cape, when he was asked a question about why are they having such high numbers, his answer was, yes, it's high numbers, because they have got an aggressive tracing process. You know, they trace contacts aggressively and unearth, you know, so many people. And so to him, the numbers that we are seeing are a reflection of the success of their tracing process. I didn't really buy into that because, I mean, even here in Gauteng, they've got an aggressive, you know, tracing process. But why is it that they have got such, you know, high numbers? So I think there is a problem there. But let's leave it, Doc. Now let's
sorry,
get
Doc.
back.
Sorry, Doc. I just wanted to add. You know, with the cases that we see, let's say we have positive cases. So we do get calls from the Department of Health where they will say that they will trace, you know, the contacts of those people that have been infected. But we don't really have visibility of what has been traced or the processes that they are putting in place to ensure that each and every person that has been in contact with that particular person that has been infected. So I can't really comment on that because we don't have visibility of that. That is what they tell us, that it's what they will be doing. Yeah.
Yeah. All right. So, right now, you know, when you look at Cape Town specifically now as a city, you know, it's one of those cities in South Africa where you've got very clear, you know, two worlds in one. You know, you've got very affluent people and also very poor people who largely reside in the Cape Flats, whether we're talking Mitchell's Plain, Nyanga, Guguletu, Kaelicha, you know. So from your experience as a doctor who is now working in that part of the world, in the Cape Flats, would you say this problem, because remember you said earlier there was a perception that it's a white person's, you know, illness or affluent people's, you know, illness. Are you getting a sense that that false sense of low risk has actually created a problem whereby the residents of, you know, the Cape Flats, you know, those who are largely Black, are actually at a serious risk? You know, so basically, I'm trying to say there was a perception. Has that perception been proven to be true, or actually the reality is actually showing us that this does not discriminate? It does not matter what color you are. So yeah, what have you observed?
Okay, I think from my observations, I think people, especially in the location, they still have a perception that it's a white man's disease. I'm saying this based on the fact that, you know, I see people still standing in long queues. Let's say if they need to access cash in ATMs, and when they need to access foods in supermarkets. And so I think that perception is still there, because even like when people are standing in long queues, you find that there's no social distancing. People are attached to each other.
Yes.
And also, I think what makes it difficult for people, because also not trying to judge people, what makes it difficult for people, like if you're looking now at the population in Kailicha, there's 2 million people in Kailicha, and there's very few supermarkets that are servicing those people. So now the crisis that those people were faced with is that there was no availability of transport due to lockdown to enable them to outsource food from less congested neighboring areas. So that was my observation. You know, that was contributing to the fact that we're seeing an increase in the number of cases.
All right. Now, let's zoom into Kaelicha. Now, a few weeks ago, we heard about the first case, you know, in the Black townships of Cape Town, which was in Kaelicha. And some of us who understand or who know that landscape started getting worried, because we thought, you know, if this thing starts spreading amongst the people in Khayelitsha, it's gonna be like wildfire. Now, 3 or 4 weeks later, what is the picture there? What is the picture in Khayelitsha in terms of this COVID-19?
Doc, to be honest, is still the same. You know, I thought that, you know, when there were news about that one instance, people will be scared, you know?
Yeah.
And, but it didn't change anything. I mean, up to date, we see people standing in queues, especially when it's time for grants and around the paydays, like 15th and the 25th.
Yeah.
So there hasn't been any change, actually.
So the behavior of the people with regards to preventative measures, it's just not visible. Do people use masks? You know, I mean, we're here in Joburg, almost every person has got a mask on, whether it is surgical masks or, you know, the face masks. Do you see something like that in the townships of, you know, Cape Town?
Yeah, there's still a few people that are wearing either cloth masks or surgical masks, but a vast majority of people are still walking freely without wearing any masks.
Sure.
Yeah.
All right. Now, we've been reading stories, Doc, about people who work in some of these supermarkets around Cape Town, where there don't seem to be, you know, measures taken by the employees to ensure their health and safety. Have you observed this when you go and replenish your grocery, Woolies and Pick n Pays and Spars and those kind of places?
Yeah, definitely, definitely. I've seen quite a lot of cashiers that have been servicing people without wearing masks. And in actual fact, I've had a patient that said to me they were not allowed by their employees to wear masks.
The employer.
Yeah, by their employer, sorry, to wear any masks, because that will bring a perception that the virus is in the shop or something like that. So, but yeah, I mean, from my own personal experience, as I've been in the shops, I've been serviced by people who haven't been wearing masks at all.
Wow. And these are like the large, you know,
The
retailers.
large retailers, yes.
Wow. Okay. And as a doctor working in that area, have you come across patients who actually present with symptoms and where you had to get them to be tested and they tested positive? I don't want names, just I'm talking in general.
Yeah, so I'm working actually in 3 different practices in Khayelitsha, Vanguard Estate, and Bishop Levis. So in between those practices, we have seen patients, obviously, that presented with flu symptoms, where we referred them. And I will get feedback from the Department of Health to say some of those patients have tested positive. And yes, they have been admitted, yeah.
And so with that exposure that you also got, you know, how are you protecting yourself, Doc?
Yeah, you know, it's really interesting, because what we are trying to do now, because if the setting that we had in our practice is that we would let patients handle their folders, and then the patient will pass the folder from the receptionist to the doctor. So now we're encouraging less handle of a folder, so patients are not touching folders at all. But basically, from our side and the staff members, we do sanitize, we wear masks, and obviously we try to ensure that patients, when they are sitting in the waiting room, we have a limited number of patients that are sitting in the waiting room, obviously allowing a distance between them. Yeah. And also within the consultation room, I ensure that there's a specific distance between myself and the patient. But obviously we do a lot of screening where we try and identify if there has been a traveling history, if there has been a history of a fever. So for those patients, we basically send them to the testing centers.
Yeah. All right. Because, you know, the usual thing is that, or what has been preached is that if somebody has got symptoms that are pointing towards, you know, COVID-19, they should not even get to your practice. They should phone you guys, and you make special measures for them to get to an isolated area where they are unlikely to infect those who are also, you know, coming for other ailments, as a way of trying to reduce the possibility of infecting other people. So, so you're saying people just rock up still, you know, even if they've got these kind of symptoms.
Yeah, you must remember, some people present with flu-like symptoms. So they wouldn't think that they have COVID, you know,
Yeah.
they wouldn't have that suspicion. So I'll be the one who will be, you know, suspicious and then pick that they have a temperature or, you know, they have a traveling history, and then I will send them. But I must say that in one of our practices, there's a lot of consultation over the phone. So patients do call to inquire if they need to go straight for corona testing or they need to come to the practice. But
so that would be the more affluent practice.
Yes, yeah, that would be the more affluent people. But obviously, in the other practice, patients will just rock up, and I wouldn't blame them because, you know, patients are anxious as well. So they will come in to say, you know, I've got flu and I've had flu for 2 weeks. I was wondering if I need to go for testing. But now the other challenge that I have is that, you know, when patients come in, they have flu symptoms, and I pick up that, you know, this one, I suspect that this one might have corona. I refer the patient, and then the testing centers won't test those patients because they will say they don't have a temperature. So those patients will be sent back home.
Now, Doc, the city of Cape Town has got a very well developed, you know, public healthcare system. What role are they playing? I've forgotten now about the province. I'm now focusing on the city of Cape Town. What role are they playing in terms of leveraging the network of clinics that they have across the various townships in Cape Town?
I think, Doc, I think I've mentioned in the beginning of our conversation that there isn't enough collaboration between the government and the general practitioners. Yeah. So what's happening is that if, let's say, we refer patients, we will only get a call from the department to say those patients tested positive. But yeah, in terms of what happens thereafter, or even during the quarantine, we wouldn't have no visibility of that.
Yeah.
Yeah.
Okay. All right. Now, some of the patients, Doc, that you guys have suspected that they could have COVID-19. Obviously, there's the whole issue of self-isolation for those who test positive, or those who are suspected and are waiting for the results. But there's also the issue of, you know, quarantine. Now, yeah, understanding how difficult things are, you know, from a socio-economic point of view, do you think it's really practical to expect people from Langa, Nyanga, Kaelicha, Guguletu to actually, you know, especially those who stay in shacks, to actually do self-isolation?
No, definitely, it's not possible. And I think just to give a point to the city of Cape Town there, I think they have established a quarantine site at City ICC where they are trying to establish 900 beds to cater for those people who are unable to self-quarantine. Okay. So definitely it's going to be impossible for most of the citizens in Cape Town because most of them are staying in shacks and some of them are staying in 1-2 bedrooms where there are more than 5 family members in one household.
All right, so at least there's been, you know, special places that have been created to, yes, take care of that. of which the CTICC is one of
one
those.
of them. Yeah.
Okay. Now, kudos to the municipality for that. Now, when you actually look at, the surrounding communities, especially in Khayelitsha, are people observing, these regulations?
Meaning the neighboring areas around Khayelitsha.
Yeah, well, I'm saying in Khayelitsha, are people like, is it business as usual, or really people are observing the lockdown regulations?
No. People are definitely not complying with the lockdown regulations. No, as I said that, you find people standing in queues, standing in supermarkets, in queues, going to access food. And also the other thing now is with the food parcels, because there are dedicated centers where people need to collect these food parcels. So we're also seeing a number of people now standing in queues trying to access those food parcels.
Without observing, the preventative
measures.
Definitely.
I mean, people are not wearing masks. People are standing just next to each other. Yeah.
All right. So I'm coming back to you again, but maybe not asking about you specifically in practice, but you've got colleagues who are working in Grooteskier, who are working in the other, healthcare centers in and around Cape Town. What sense do you get from them, as far as PPEs, personal protective equipment? Are doctors there happy and comfortable that their employers are actually doing enough to help them to not catch this virus?
To be honest, Doc, I think we've been living in our own cocoons. We haven't been, I mean, I've got friends that are working at Grooteskier, but I haven't been like in contact with them just to check, if they are wearing PPEs to protect themselves. Yeah. So I think it's just, normal working, normal day, Yeah. There hasn't been that interaction amongst us just to check on each other.
You see, because here in Gauteng, you'll have a situation where health workers in a particular facility, they would actually threaten to strike because they feel they are being exposed. So you haven't heard of such, in and around Cape Town, which then would mean maybe, the government is doing well in that area.
No. I haven't heard of that complaint specifically in Cape Town. Like, as I said, that we don't really have an interaction now. I think people are busy as well, except for one of our WhatsApp groups where I usually see that there are complaints about lack of PPEs, but not specifically the interaction from the friends that I have.
Now, Doc, that particular supermarket, and we're not going to make or mention any name, all right, but that particular supermarket that had 55 employees that tested positive, have those people, undergone the 14-day period of self-isolation, and have they gone back to work? Do you know anything about them? And again, we're not mentioning names.
Okay. In my understanding, they have undergone the 14-day quarantine phase. They were supposed to go back to work today, but I haven't heard anything from the employer, what he has decided on.
But so, I don't know. You guys consulted to give advice on, what steps should be taken as part of their reintegration back to the workplace?
Yes, I was actually personally contacted by the owner of one of the supermarkets, and he wanted me to actually do assessment to check if those patients are fit to go back to work. But as I've said, I haven't heard from him.
Okay, yeah, all right. So, Doc, listening to you, your view about the province, how it has dealt with this pandemic, and also just now zooming closer to the Black townships, the fact that there doesn't seem to be much visibility of public health, campaigns for social distancing and other measures. Are you worried?
I'm very worried. I'm very worried. To be honest, I'm very worried because I'm in the key center of Kailicha.
Yeah.
Yeah. And I see this on a daily basis. So I'm very worried.
Yes. So if, Doc, you were, almost you've got a long experience as a medical doctor, but also you've got a long working experience in the corporate up to senior management level. So if you were asked, to act as an MEC of health in that province, what would you do differently?
Okay, I think the key thing for me is definitely to raise awareness through constant education. The reason I'm saying this is because, when I have an encounter with patients and I teach them about COVID-19, there's a lot of things that I'm picking up that, people still don't know what's going on, So we need to continuously raise awareness through education at the level that people could understand.
Yeah.
And then the second vital thing that we need to do is that we need to deploy health professionals to test all the suspected people, especially in high-risk areas, so that we could be able to identify those infected people and quarantine them on time to prevent the spread of the virus.
Yeah.
And then the other thing that's concerning me, which is a good thing that government is currently doing, is the food parcels. Yeah. So I don't know if we should have a campaign where we try and deliver the food parcels. Yeah. I don't know how possible that is, rather than having 5,000 people standing in the queue the whole day, because that's also increasing the
risk of transmission.
Yes. There has to be collaboration between the health professionals who are in the forefront with government officials, because we are definitely working in silos. We don't know what's going on. We don't even know some of the protocols that are put in place. So we need to have that collaboration so that we could benefit from each other's resources as well.
Yeah. So it doesn't really paint a very good picture, Doc. Our conversation so far. I'm actually more worried now than even before we actually started speaking, because I thought when I talk to you, you will allay my fears and say, okay, it's because you guys are too far, you don't really understand certain things. But from what you are sharing, there doesn't seem to be a very well thought through, intervention strategy that is focusing on the preventative side of healthcare. And that to me is worrying. And like you had said, the winter is still coming. And the winter in Cape Town can actually be quite harsh, and we know that the virus loves, very cold winters. So we are actually, in for a serious challenge in that part of the world. And on the other hand, there's also reports of, migrants from the Eastern Cape who are actually being sent back to the Eastern Cape after they have done, what they needed to do in terms of harvesting in the farms in and around Cape Town. And some of those are actually infected, and they are actually taking that back to the Eastern Cape province. A lot of kumbis have been stopped between the Western Cape and the Eastern Cape and some of those workers are actually showing symptoms. And so it's almost like export of the health situation from the Western Cape to the Eastern Cape, and the Eastern Cape obviously has even worse type of healthcare infrastructure. So for me, that is worrying, and there doesn't seem to be much collaboration between the two provinces that are actually neighboring provinces. And it doesn't help the fact that that province is the only province that is ruled by the official opposition, whilst the other 8 are ruled by the I would say the governing party nationally. And so the picture that you are sharing and the dynamics that have been there, racial dynamics, class dynamics, language dynamics, and also just inequality dynamics, they are worrying. I think from your from your interview, or from the interview that we are having, it might just be important for one to follow up with somebody from the government side of things, to try and get a sense of what is it that they are doing to try and deal with this particular issue. Because, when you say there's no collaboration, there's a silo approach to doing things, at least one thing that I've been happy to see here in Gauteng is the collaboration between the private sector and the public sector. From time to time, the private hospital groups will meet with the MEC of Health of the province, and they would look at, how many ICU beds do we have, how many ventilators are there, so that should there be a need for, a spillover to the private sector in terms of, need for those beds, there's already some understanding between the two parties. Now, from the picture that we are sharing, it doesn't give a sense that should there be, huge numbers into the public health system, there would be an easy way for collaboration between the public and the private. And so that is really, really, really worrying. So, Doc, those people who are watching this interview from Cape Town, what message do you have for them? You are the doctor, you are working in the coalface in Khayelitsha, and you have been dealing with cases, whether they are from employers or just patients coming to your practices. What do you want to say to them?
Okay. I think my first advice will go to those people that have pre-existing conditions. So I think what I want to say to them is that, they need to take their medication regularly. And if there has been anyone who hasn't been compliant on their medication, they need to go back and consult with their doctors so that they could be started on their medication. Because remember, we don't want anyone that is going to be immunocompromised, especially at the state. And then largely to the community of Cape Town, I would advise that people avoid congested areas. And then if possible, people should work from home, and people should stay warm. They must take their supplements. I mean, we've heard everything about vitamin C. People have concussions now they're drinking hot lemon. And then just take necessary precautions. I mean, if you have to go to work, make sure you have your sanitizer and put on your mask. That's critical. And eat healthy. And then the last thing that I want to say is that, a happy heart is a healthy heart. So try and stay happy, because as we know that there are key enzymes that are elevated on the system should you become sad. So you need to make sure that you stay healthy so that your immune system can be strong. And then I think one word that I have for the government officials, I would really, 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 appreciate if they could go to places like Khayelitsha, Langa, Mitchell's Plain, just to have a visibility of what's happening on a daily basis, because I'm not sure if they have sight of what's happening if you stay in places like Paru or Table View or Blowback. You might have, a different picture once you go to Khayelitsha and see what's going on, so that we could work together, and try and find a solution.
And to employers, what message do you have for employers? There could be one or two people, who are watching or who will watch this video when it circulates. What message do you have for employers, like the supermarkets?
I think not to be harsh, dog, I would like to say to them, let's put finances aside, let's try and ensure that employees are safe, because at the end of the day, those employees have their families. And there's no guarantee if an employee is infected that it cannot infect an employer. So I think they need to be vigilant and make sure that, they use all the necessary precautions to ensure that employees are safe. I mean, we've had incidences where we've had that there's been employees that have died actually from corona in Cape Town, in one of the biggest supermarkets. So we need to prevent that. And I'm begging them to ensure that employees have the necessary, things to use, like your masks and the sanitizers. If there's anyone that has a pre-existing condition, they must send them back to the doctors just to inquire if the patient is fit, to be in the front line.
All right. So, Doc, I think you've managed to create a picture for us. Unfortunately, it's not a very nice picture. It actually worsens the concerns that some of us had. But let's hope that it's not too late. Let's hope that there could be a turnaround. The stuff that we saw in Italy, the stuff that we saw in Spain, the stuff that we are seeing now in New York is not something that we want to see in Cape Town. And so I think the various stakeholders that deal with matters of health in the province and in the city specifically, there needs to be a closer working together because otherwise we are going to see a situation where the health system in that part of the world is actually overwhelmed, and we don't have enough ICU beds, we don't have enough ventilators, and so some of those people will end up dying. And so I think more needs to be done now, even before the winter actually gets to its peak. So please play your role as a frontline healthcare worker, but also don't forget to make sure that you are safe yourself, because after work, you come back home. You don't want to bring that infection to, to your family members here at home. All right. And I think with the levels of poverty that one sees in and around the Black townships of Cape Town, I think those who are fortunate enough to be able to give should actually also try and do more to add to what the government is doing in terms of those food parcels. So I think this is the time where we need to have human solidarity. Those who are more privileged, they help those who are less privileged, and all of that. So I want to thank you for your time, Doc. I've taken an hour of your family time because of my curiosity, to try and help other people to have a sense of what's happening in Cape Town. Let's hope next time we talk, it will be a slightly different situation from what you have painted. So thank you very much. And thank you to your son for making sure that everything is connected so that we have a successful interview that has got no glitches. So thank you to him. And may you continue to do good work in the coalface of those townships in Cape Town. And some of us will continue to look from far and hope for a turnaround. So thank you very much, Doc.
Thank you. Thank you so much, Doc. Thanks so much.
All right, lovely.
Okay then.
All right, sure. And thank you to all our viewers. It's not been a very good picture that we have had, but let's hope that those who are in positions of authority will actually try and change the situation for the better. Thank you.